Welcome to Just Energy Radio with your host, naturopath and medical intuitive, Dr. Rita Louise. We have learned from Einstein's theory that matter and energy are one. Physicists believe that all systems in nature have their own particular way of vibrating. From the swinging of a pendulum to the waves of the ocean to the light that brightens the sky each day, each of these oscillates at its own unique rate. The same holds true for every thought, feeling, event, or word we speak. Each has its own frequency or rate of vibration. What many of us don't realize is when we take everything in our universe down to its simplest form, it is all just energy. Join Dr. Rita Louise on a journey through time and space where past, present, and future collide. Today, what you believe may be called into question. What we want to know is, who made up the rules? Be brave and step outside the box. We are about to turn our world upside down and venture into the unknown. Hold on. We are departing our own beliefs and entering alternative realms. Enjoy the possibilities.
Hello and welcome to Just Energy Radio. I'm your host, Dr. Rita Louise, and thank you all for tuning into the show today. Wow, we have an extra cool show, and I wish we could have gotten my guest on earlier in the year because we're going to be talking about the ins and outs of ObamaCare. And I think it's just a topic everyone needs to get some insight on because nobody knows. I don't know. I don't think anybody knows what that's all about. But just a couple of reminders. Just Energy Radio is brought to you by soulhealer.com and can be heard every Thursday evening from 8 to 10 p.m. Eastern Standard Time live here on the Inception Radio Network. But if you've missed an episode, you can always go to our show webpage, www.justenergyradio.com, and check out our over 6 years worth of archives. While you're there, you can sign up for our weekly newsletter to keep you informed of who's coming up on the show, which is cool. And we also have about over 2 years worth of archives on our YouTube channel, which is Just Energy Radio on YouTube. And let's see, and you can also friend us on Facebook, Just Energy Radio. See, if you just remember Just Energy Radio, you'll know everything. Well, except what's on soulhealer.com, which, you know, is everything about me. Which you want to check out because we talk a lot about healthcare, which is what we're going to be talking about today, except, well, I won't get on a little soapbox thing. Let's see, anything else that I want to mention? And as I say every week, don't forget you can download the Inception Radio app for your phone, and you can like listen at work, listen in your car to all the programming that's on this network. So let me tell you a little bit about today's guest and get him on the air because I have millions of questions and we're going to get all the answers. So we're going to be talking to Nick Tate. And so Nick J. Tate is an award-winning journalist, editor, and author who has written extensively about health, business, technology, finance, music, and consumer affairs issues. He is currently deputy health editor for Newsmax Media. His work has appeared in Newsmax Magazine, the Miami Herald, South Florida Sun Sentinel, Atlanta Journal-Constitution, Boston Herald, Health Radar newsletter, and other print and online publications. His latest book, The ObamaCare Survival Guide, published in October, was ranked among the top 20 top-selling books on Amazon.com and Barnes & Noble's top 100 books list in January of 2013. So the author of ObamaCare Survival Guide and from www.newsmaxhealth.com, Nick Tate. Hey, Nick, how are you?
I'm well. Thanks for having me. It's good to be with you today.
Well, I am just so glad to have you on the show. And I think I'm even more glad that you took the time to, I'm assuming, reading the 2,000 pages of the health initiative and reporting back to us what you found and what impact ObamaCare is going to have on all of us.
Well, I think it's an enormous piece of legislation, and it is really truly going to affect virtually everybody in this country. I did indeed read virtually every word of the 2,700 pages of the law, and new pages, new words, new laws are being written almost every day. So it's something of a dynamic law. It's not set in stone, but it's continuing to evolve with new provisions rolling out almost every day.
It's just unbelievable because from what I gather, the 2,000 pages isn't even any procedural type things. It's just all policy, correct?
It is. It's an overview of the variety of ways in which the federal government will be requiring changes in the healthcare system. And so now what is starting to happen is the language that says, here's how we're going to do this stuff, whether it's the individual mandate, the new requirements on businesses, the changes in Medicare, the details of how those laws are going to actually affect people, kind of where the rubber hits the road in healthcare. That's what's starting to roll out now.
Yeah, because the reality is it doesn't actually implement, quote unquote, until next year. They're just trying to get things lined up for that. Well, I mean, except for the payroll tax deduction that they've already gotten.
Well, there are a couple little things that have rolled out. There are a couple provisions we can talk about if you like that have already taken effect, but you're absolutely right. The big stuff really doesn't start to take effect until January of next year.
Okay, and we will get to all of that because I have a million questions. You know, both information that was in your book, information that I think people need to know about, but all right, and I'm going to throw it in, you know, some kind of conspiracy questions that have been floating around, you know, like death panels and blah, blah, blah. But we'll get to that.
Okay.
Nick, tell us a little bit about your background and why you decided to even tackle this topic.
Well, I've been working as a journalist primarily covering consumer and health issues for almost 30 years. And I really take very much, place a great deal of emphasis on the kind of, the helping component of journalism. I've always believed that the best thing you can do in journalism is help people live better, spend their money well, and make good choices in their lives. What greater impact can you have on your health than making sure that your health insurance is what you need, that you know what your choices are, and that you're living in a way that allows you to both maximize your healthcare dollar, which means spending as little as possible, but also gaining as much in terms of health and healthcare. What better way for a journalist who covers healthcare to move forward than to really try to dissect this enormously complex law and make it what? It's not simple. This stuff is not simple, but I hope that the book translates the laws in a way that lets people know, whether you're a senior on Medicare, whether you're a college student, whether you're an independent contractor or a small business owner, have a pre-existing condition, here's how this law is going to affect you. So that my job, as I see it, is to translate what the government's doing in a way that lets people know from a healthcare perspective, here's how it's going to affect you. And then this law is truly a game changer, in my opinion. And in the 30 years that I've covered healthcare, it's probably the biggest deal that I have seen, at least in my career.
In the very general sense, I mean, what do you think of the bill? In a real general sense. I mean, because obviously we're going to get into a lot of details, but what's your, just your personal opinion?
Well, as a journalist, it's really not my place to weigh in and take sides and say whether this is a good or a bad thing. And I really should be clear about that. The intent of the book is not to say, this is an awful thing that's really going to hurt business and raise your costs for healthcare, or on the other hand, make it an unvarnished endorsement of Obamacare. What I really want to try to do is provide an analysis of the law that's very consumer oriented and consumer driven. So when you ask me my personal opinion, I can tell you that I think there are some intents of the law that are noble. Who's going to argue with the idea of making sure that people can have affordable health care? Who's going to argue with the idea that if you have a pre-existing condition, you should be able to get coverage for whatever condition you have? Who's going to argue with the idea that prevention is better than treatment? Doing what you can with wellness and preventing a disease is a better way to go than actually having to get into a care situation when you have cancer or heart disease or diabetes. So I think while there are clearly some noble goals of the legislation, but it's also my personal opinion that the way this law was created, the way that it's going to roll out, there's also going to be some pain financially. I think there are going to be some issues with access to care and doctors that people are going to face. And I think there are going to be some unintended consequences that are going to be really what I would describe as negative. So there are some winners here, there are some losers here, and my hope is that the book lays out how you can figure out where you are on that continuum and what you can do about it.
And I do want to say that I thought it was very readable, for the layperson to just kind of get an idea and feel of what's going on, because I feel like there's a lot of misinformation, a lot of rumors, a lot of things that aren't really being discussed that impact everyone. For example, go ahead. Go ahead.
I was just going to agree with you. I think that this is one of those issues where virtually everyone has an opinion. They like it, they don't like it. They like some of it, they don't like some of it. But some of the myths and misconceptions about what's in the law, what it will do, and what it won't do are really extraordinary. And I have to say that on balance, people on both sides of the issue have floated some big whoppers. And part of what we're trying to do with the book is provide a critical analysis that really gets the truth about what's in the law.
Okay, good. What I was going to say is that there are many people that think Obamacare is the best thing since sliced bread. In the general sense of the word, do you think, well, never mind, I already asked that question. Do you think, or one of the opinions that came out early on is that it's going to be quote unquote free? I want to tackle the money issue first, because, I think everybody's a little short on cash these days. And that was one of the things that I felt they were really marketing, oh, well, everyone is going to be able to have universal health care and it's going to be free. Is it free?
Of course not. And in fact, it's going to cost more. This healthcare system that we are getting is going to cost more. Healthcare costs are going up. There's nothing in the law that puts price controls on healthcare or keeps those prices down. That's number one. Number two, if you have insurance, there's nothing in the law that keeps insurance companies, your insurer, from passing on the increased cost of healthcare to you and higher premiums. And in fact, what we have really seen in the 3 years since Obamacare was signed into law is healthcare costs have continued to rise by between 4 and 4.5%. And healthcare insurance costs have continued to rise. I think the typical household now pays almost $16,000 a year, either independently or through an employee's employer. And those costs, there's nothing in this law that is likely to lead to a reduction in those costs. The best that even the White House and the administration has said they can hope for is that this law will slow the rise in costs so that healthcare costs and insurance costs don't rise as high as they have in the past. And in fact, there is some evidence to suggest that in the last 3 years there has been a slowing in the increase of healthcare costs. But make no mistake, it's not free. Healthcare is not free, and it's going to cost more money over the next decade, virtually from everyone's perspective, whether you're a proponent or an opponent of the law. Virtually everybody agrees that it's not free and it's going to cost us all more.
When they were first coming out with it, that kind of wasn't what they said, or the way I recall it being stated was, if you don't have insurance, you would now be able to be covered.
Well, there is a kernel of truth to that. There are two things. If you are a low income, if you're poor, you will qualify for Medicaid. And the federal government will, in fact, spring for the cost of Medicaid for those truly needy people who require health care. So if you're uninsured and very poor, yes, you're not going to be spending as much on health care. It's not going to be free, but you will have premiums covered and you will have your base coverage. But it's something of an untruth to say that it's free, because somebody's paying for that. You're paying for it. I'm paying for it. We're paying for it in our taxes, and we're all paying for it in terms of our health insurance as well. The other thing I should say is The president famously said, and I don't want to pick on the guy, but he famously said during campaigns in 2008 and 2009 that under an Obama administration, this law would lower the annual premium for a family in this country by about $2,500 a year. That has proven already to be untrue. And in fact, the cost increases have gone up by about that much each year since he made those statements. So I think you're right that the emphasis on let's get people covered, and by the way, it's going to be a good bargain for us too, and it's going to pay down the deficit, and et cetera, those early political statements have certainly proven not to be true, and there are very few people who today will argue that they will be true over the next 10 years. So it's true, there's no free lunch, and there was no emphasis on what this really will cost us, and there are many new laws and new surcharges and new fees that continue to roll out almost weekly. We keep hearing about new provisions of the bill that are going to cost more money that we had not heard about before, and I expect that's going to continue.
Can you give an example?
Sure. About 2 months ago, the federal government said that to fund the requirement that if you have a pre-existing condition, under the law starting next year, if you have a pre-existing health condition, cancer, heart disease, diabetes, an insurance company can't reject you and say, we're not going to cover you because you're too high risk, you're going to be too costly, nor can they charge you more for your insurance if you have a pre-existing condition. That's going to cover about 130 million Americans with pre-existing conditions, but they hadn't really come up with a way to fund the cost of making sure that people with pre-existing conditions don't pay more for their insurance or are denied. Well, a couple months ago, the federal government said that now every company is going to pay about, I think it's a $63 per head, per capita fee for every employee in their company that they insure. And that amount of money is going to pick up the cost and cushion the increased cost for covering people with pre-existing conditions. Likely that amount of money will be passed on from companies and insurers to individual workers. No one's sure yet how that's going to play out. It's going to kind of be up to the companies, but no one talked about that at the start of this. No one talked about that as being part of the mandate on businesses covering their own employees' health insurance. So there's just one example of something that's come out in the last couple months. And I think as the new changes roll out and the implementation rolls out, some of the early number projections are going to change, and in fact they already have. The cost projections have consistently gone up well beyond what they were initially proposed to be. So, it's going to be a little bit of a numbers game, and for those people who are watching their checkbooks and their bank accounts, which is all of us these days, it's really going to be important to pay attention to see what's going to be coming your way with costs like this.
What it makes me wonder, I mean, I can understand that hospitals and whatever had to pay for, or deal with people that didn't have insurance, for emergency room type situations. But from a monetary perspective, all right, I know that, my husband pays for our health insurance and his went up $50 a week just over the course of the new year. And it was already astronomical, and it's really crappy coverage, And, so if if healthcare premiums are going up and then they're talking about taking more money, to cover all of this other stuff, if somebody does a cost comparison, it almost seems like they're going to be making more money to cover a lower bill than we were paying when people didn't have insurance in the first place. Did that make any sense at all?
It does. The thing that we need to consider is that under Obamacare, about 37 million people who don't have insurance now will have it by law as of next year. That's a lot of people whose health care will need to be paid for and covered in some fashion. About, I think the number is 12 million of those folks, 10 to 12 million, will be getting their coverage through Medicaid. And so the payment for that is largely going to come from the federal government, which means our taxes and our tax money, everybody. So you're right, there is a dramatically increased cost for accomplishing the insurance goals of Obamacare. I'm not sure if you went back and did the projections before Obamacare to indicate whether costs would be more without Obamacare or less without Obamacare. It's such an enormously complicated law and an enormously complicated system that it's really hard to say whether we're getting a better deal now than we would have had nothing happened. And we have to also keep in mind that one of the hopes about Obamacare is that people who have insurance will see a doctor. They'll take steps to preserve their health and be healthier. If you see a doctor and you have insurance, you may be more likely to watch your diet. You may exercise. You may take a cholesterol-lowering drug or do anything that you can to prevent heart disease that leads to a heart attack, which requires a hospitalization. And if you're uninsured, you don't pay for that, but the hospital passes on those costs through to other people who pay insurance, and we pick up those costs at hospitals. So the hope is those 37 million people who now don't have insurance, who get their primary care through a hospital, typically for a serious condition like a heart attack or an advanced cancer, those folks having insurance may be more likely to do a better job of preserving their health and heading off that bigger cost at the end. But that's kind of a long-term shift, and no one's predicting that that's going to lead to any kind of short-term savings in the long run. There's a lot of money in the healthcare system, and the question is, how can we make sure that it is best spent in helping people prevent those big problems down the road from a health perspective, and really invest in their health up front through holistic living, eating well, diet and fitness, and making sure that you're doing what you can to prevent developing heart disease and cancer and the big killers and the big costly sorts of conditions.
It just seems kind of like this vicious cycle, because then you throw in the whole big pharma angle, and they don't want people to get well. They just want to sell prescriptions. Although, if you have more people going to the doctor taking cholesterol medication or some kind of diabetes medication versus eating healthy and losing weight, you could have a match made in heaven there.
Well, one of the things that is really just personally disappointing to me is there's not more of an effort made in Obamacare to take advantage, to push wellness and really to push prevention in the way that you're talking about. Why can't we if we can give people a tax break for, mileage expenses and business expenses and, lunches, why can't you give people a tax break for joining a gym? I'm going to get myself into trouble here, but can we use the SNAP program, the food stamp program, to drive people to buy healthy food as opposed to candy bars and chips and soda? If we could do that through healthcare reform, we might actually be driving people away from obesity and toward healthier lifestyles. But those are the kinds of things that are really not in the law. And they're the kinds of things that will only happen if people take the initiative. And we have seen a great many people in this country don't take the initiative. What is it? 30%, I think, according to CDC, of Americans are clinically obese. So I feel like there was really a missed opportunity here to drive the kinds of wellness and prevention that we see in places like Europe and, frankly, Canada, that where people are living healthier lives. They're not dying as early as we are in America from preventable diseases, and they really take to heart this idea that healthy living is a lifestyle issue. It's not an issue that is addressed by taking more drugs and medicalizing the issue. It's a way of life and changing your life to live a lower stress, higher health lifestyle. But there really isn't much in this law that kind of drives us in that direction, which is, in my opinion, where I think this country should go.
I agree. I mean, I do alternative health counseling, and compliance with a client is a joke. If they know they need to take this pill for 10 days and they're on some kind of an antibiotic, they maybe can wrap their mind around that. But if you tell them you need to do a 2-month cleanse and you need to modify your diet, you maybe get 10% compliance. It's really low.
I was watching Jon Stewart interview Steve Jobs' doctor not long ago, and what he was saying to to Jon Stewart is, people really need to get out and they need to exercise and they need to watch their diet. They need to have low carbs and, eat healthy foods and a lot of fruits and vegetables. And Jon Stewart's response was sort of predictably clipped and funny, but he said, well, can't I just take a couple, fish oil tabs? Because that sounds a lot better than going out and exercising every day and actually having to worry about my diet. But I do think there's some truth to that joke, which is it's a lot harder to live a healthier lifestyle than it is to think, well, if I get sick, I'll just take a pill. But it's not real wellness. The as you say, cholesterol-lowering drugs are safe, and lots of people take them. And for those folks who have already tried through diet and fitness and lifestyle modification to reduce their cholesterol, and they still need a little extra help, it makes sense. But it's my fear and my worry, and I think it's based partly on what I've seen in 30 years of covering health as a journalist. I think for many people, the drug and the pill is the option of first choice. And, Big Pharma has an interest. They deserve to make a living, those folks, and have a business, and I'm not knocking that. But the push from Big Pharma is, you got a problem? Here, we can fix it. Here's a pill. This will make you lighter, healthier, happier. And I think that with many medications, we're really being sold a bill of goods. We would be better off eating well, exercising every day, getting proper sleep, and doing what we can to lower our stress levels. But that stuff's not easy to do, and I think that's one of the reasons that the pills become an easy solution.
But we're also really not programmed that way. I mean, not as a species, but as Americans. We were led to believe, well, if there's something going on, you take a pill. And even with people that I've worked with that are pretty open-minded and pretty open to the idea of alternative, I'll ask them, it's like, well, have you tried doing this? And they're like, no, because they'll go to their doctor and their doctor will say this, but the doctor never, I'll give an example. I threw my back out. I mean, I couldn't stand up. And so they gave me muscle relaxers and they gave me painkillers. And basically I was on the sofa not moving because I couldn't stand up and I couldn't hardly walk. And so I was talking to my mom on the phone and she goes, well, are you taking hot baths with Epsom salt? Well, 2 days later, I was at least standing up straight again and kind of walking versus the 4 days that I spent on the sofa not feeling any better. And so there's a lot of things that we can do. I like saying, old school, that just get overlooked. And if the doctor had said, go soak in the tub, I probably would have done it.
Well, I congratulate you for taking the initiative to do that. Sometimes those lessons are very hard. And I have to tell you that I have back issues myself and have had the experience of being on, the painkillers and the muscle relaxants. And what turned it around for me, I herniated a disc about 15 years ago. I started swimming every day. And I found that not only did the pain go away, but I lost some weight. My heart health improved. And my stress level just plummeted. I work in a very stressful industry, obviously, as do you, working in media and journalism. Getting into that pool 25 or 30 minutes a day, nobody could call me on my phone. Nobody could harass me. I wasn't writing. It was truly therapy for me as much as it was exercise. And there's a lesson there. I will also tell you one other thing, and that is I think in some ways, if you've had an experience like this, it makes you focus a little bit more on doing the right thing for your health. It's sort of a cliche that in some ways the best thing that can happen to someone from a health perspective is to be diagnosed or experience a manageable condition, whether it's an injury, a back injury, or some kind of manageable condition. Prediabetes is another one that I can think of, that forces you to really reevaluate how you live your life and what you're doing. You have to figure out a way to deal with the pain. You have to figure out a way to keep your blood sugar at an appropriate level. You have to figure out how to make sure that your fitness level is at an appropriate level, your weight, your diet. And for me, that experience with the back problem was sort of a revelation. I lost weight, and I continue to swim or exercise virtually every day. It's almost for me the same as sleeping and eating. I feel like I need to do it every day. And there's a lot of science and research to support it, and it seems for me, certainly it's true, and I think it it's also true, the science shows that it's the better option than waiting for a condition to really get serious, where it can only be managed medically or through surgery or through radiation. I would like to see us as a country move in that direction and embrace that kind of wellness, and I do see it in other countries. It's a cultural shift, though, and my hope is that you're obviously practicing what you preach, and you're getting the message out. My hope is that maybe more people will be reached by this message, and with the increasing cost for healthcare under Obamacare, who knows? That could be an upside. It may drive people to look for more affordable options than healthcare to manage their health and their wellness. We'll have to see.
Good point. Speaking of managing our own health care and, the idea of alternative health, what gets thrown under the alternative health umbrella, there are rumors that they're going to try to get rid of it. I have some friends that are chiropractors, and they are scared because there is a lot of legislation that's trying to make it where chiropractic is no longer a licensed profession and blah, blah, blah. And in the last, I don't know, I'm going to say 20 years, that has in general been accepted under most insurance policies. And there's been a push to get more alternative healthcare coverage covered by insurance. But with Obamacare, it's kind of like, how does that fit into the whole plan?
From what I can tell, it really is an afterthought at best. And it's really unfortunate, because I think that the more research that's done into alternative medicine, whether it's chiropractic, acupuncture, Asian techniques that have been practiced for hundreds of years, there's the science is now starting to support that. In fact, there's a tremendous benefit. If you're a patient recovering from cancer, if you're practicing mindful meditation, you recover better. You feel better. Your outlook is better. Your point of view is improved, and your immune system is boosted. There's science to back that up. People who have back and neck problems with pain have great relief from chiropractic care that is probably more affordable than other kinds of, certainly more affordable than surgery, certainly better than long-term narcotic meds or muscle relaxants. But there is not really much in Obamacare that emphasizes or pushes that idea. And I do think that for people who practice alternative medicine or are interested in alternative medicine, the money's going to come out of pocket to pay for it, which in difficult times makes it very hard for practitioners to continue. Now, one thing that I do think is hopeful is there are new, what they call it's a team approach. The accountable care organizations is the way that they're referred to, but it's a team approach that brings together a team of doctors and specialists to work with a patient. So in theory, if you're a patient who has a condition that is a pre-existing or chronic condition, you'd have your primary doctor, you'd have a specialist, you might have a nutritionist, you might have a physical therapist, and you might have someone who is in the area of alternative medicine be part of that team. If it can be demonstrated to the insurance company that it's actually helping the patient improve health, deal with the condition, and ultimately live longer. But those are experimental pilot programs that are part of Obamacare. They're not front and center. They're kind of on the fringe. And what will really depend on how much money is spent in emphasizing them, whether they will move forward. What I think will happen, and I already see it happening with people that I know who do practice chiropractic and other forms of alternative medicine, is they're partnering. My brother-in-law, I'll give you an example. Dr. Robert Newman in Long Island is a chiropractor and a certified nutritionist. Well, he's now working with an oncologist, so that they are kind of coming at the problem with the patients who are dealing with cancer from both ends. They're approaching it with the best of conventional medicine, and they're also approaching it with the best of alternative medicine to try to boost nutrition, boost lifestyle and wellness at the same time that they're treating the cancer from a conventional perspective. What a wonderful thing, don't you think? If both sides of medicine, both hands of medicine could kind of shake hands with patients, so that you're really taking advantage of the benefits of alternative medicine and at the same time taking advantage of what the best of conventional medicine has to offer. The problem is, my brother-in-law is doing this because he's interested, and it's an independent effort that he's making, and I would like to see more partnerships like that develop. Will they happen over the next 10 years as Obamacare rolls out? We'll just have to see. There's really nothing in the law that pushes us in that direction.
And it would be nice to see, it makes me think of and whether this is true or not, I can't say, like those cancer centers of America or whatever, where they look at, all of you. I mean, my hope in looking at those commercials is that they're really doing kind of a body, mind, spirit approach to helping people get well. And I think for medicine to be truly preventative, or at least somewhat preventative, we need to look at the person in that way and not just as a bunch of symptoms and here are the pills that you can take for it.
You're absolutely right about that. I completely agree. Let me tell you about one other thing that is emerging that is, I think, a hopeful element. There are new models of primary care called patient-centered medical homes. It's a type of care. Very few doctors in this country now practice it, but essentially it's a primary care doctor who hires enough people on staff and relies on a constantly updated electronic database of the best practices of medicine in treating their patients. But they do more than that. The way it has been described to me by South Florida doctors, which is where I am, who practice this patient-centered medical homes approach, is they're treating people. They're not treating cancer or heart disease or diabetes. They're treating people, and maybe they have cancer, heart disease, and diabetes, but they're really treating the human being. And so it involves everything from diet and fitness counseling, mental health counseling, stress reduction, and yes, if you need to get on a cholesterol-lowering medicine or you need to get care for a particular condition, they're in a position to coordinate that as well. But the approach is very, very much, the way I've heard it described, it's kind of like a return to Marcus Welby-style care, where you grew up and you had the same doctor from the time you were a kid until you got into adulthood, who kind of knew your family, your background, what your situation was, and could really be in a position to be a true counselor, to really boost your wellness and your health. And it's marrying that with the technological advantages we have today, where doctors can get the absolute latest results of tests that show this kind of treatment for that kind of condition is the most effective for the largest number of folks. Now, in Obamacare, there's a small piece of the law that does kind of create the opportunity for pushing these pilot programs if they prove to be successful. And they're starting to roll out in places like South Florida and other states. But again, it's one of those things that, why isn't this approach front and center in healthcare reform? Why is it kind of on the fringes? It doesn't make sense to me. But again, I'm hoping that this kind of approach to primary care may in fact be really beneficial to folks and get us further along the line of pushing prevention and wellness over treatment and after the fact care.
But those Krispy Kreme donuts taste really good. Do you have Krispy Kreme in Florida?
Yes, we do. Yes, and I've been known to have one now and again. They're wonderful. But I'm thinking everything in moderation. As long as I don't have them for breakfast every day, once in a while, and if I compensate at the gym that day, then it's probably okay. But you're right. I mean, it really is very, very tough in this country to resist the junk food and the advertising, and it's just so easy. It's just so easy to go to the local burger or taco place as opposed to make healthy food. But you know what the truth is? For foodies, if you talk to people who are really into food, healthy food can be delicious. It doesn't have to be, bland food that doesn't have any taste and no spices. For me, I like to cook. It's a personal thing. I love, more than anything, rather than going to a restaurant, I love having people or family over and cooking. And knowing that what I'm making is healthy for my kids, my family, my wife, my friends and family that come over, it can be good. I grant you, I would never want to take anybody's Krispy Kremes away once in a while, but just as an occasional treat, that's the way to go. If you're eating regular healthy food every day, and most of the food that you're eating is good, then my feeling is you're probably okay with a Krispy Kreme once in a while.
But for a lot of people, that is, it's the McDonald's. They don't want to take the time to cook the food or make the food or think about making the food, which I think is just sad.
I agree. I do believe that someone could do a really good public service and they probably exist. I'll have to investigate this, but if you could come up with the 15-minute recipe book that could allow you to make a dinner in 15 or 20 minutes, and there are many things you can make in 15 or 20 minutes that are healthy, that are vegetable-based, that have whole grains, that have lean protein, you don't need to spend hours and hours in the kitchen. I think that's the mistake that a lot of folks make is, it's too much work. But you can prepare a healthy meal in a relatively short period of time, maybe with the power of the internet going on every night and figuring out how to fit time in would be the way to go. The other thing to keep in mind, too, is you don't really think of it this way, but if you don't feel like you have time to prepare a healthy meal and pay attention to your health and wellness at the front end, you're certainly not going to have time for a 2-week hospital stay because you're sick. You're certainly not going to have time to deal with all of the doctor visits and the care that's required because you have an obesity-related condition like heart disease or diabetes. So in the end, it may seem like it takes more time to prepare a healthy meal than to go with fast food or junk food, but in the end, it may be the most cost-efficient way you can go in terms of time.
All right, so I don't want you to laugh, but I'm a freezer queen. I will make like 3 chickens at a time, like whole chickens, and then bag it up because we'll have 1 chicken for dinner that night. And then, a week later or whatever, I'll take that chicken, one of the ones that are in the freezer out and chop it up and, maybe make like some stir fry with it or, whatever I do with it. But I have this stuff for those days that I don't feel like cooking or I don't have time to cook something that day. I always have backup, because I maybe eat out like, there's real restaurants and then there's junk food. I maybe eat junk food like maybe once every 3 months. Pretty much everything's homemade, but you don't want to cook all the time. So I have my little like freezer things. It's like having a TV dinner, but not.
It's such a smart thing to do. Now, I'm going to tell you, I'm Italian. I'm an Italian American. My mother cooks, and I grew up in a household where she cooked all the time. But when she made sauce or she made something that was going to take a while, she would make sure that she made enough batches that there would be sauce in the freezer for 3 or 4 other nights at some later date. It's an old style approach. Maybe it's an old world approach.
It's that old school thing.
Yeah, but it's a good thing. And maybe everything that's old is new again. And I commend you for doing it because you're certainly doing yourself a favor than as opposed to buying frozen TV dinners or those kinds of things. It's a healthier choice. And
but they're disgusting.
Oh yeah. Oh sure. They're loaded with salt. They're loaded with fat, and God knows what else. You're better off with what you're putting into your own food, and it's, for me, I think it's going to taste better too. I think it is.
But and I don't know if you have noticed it. I don't know where you shop, but I live in Texas, and you'll go to the supermarket. There's like the health food store, which we don't really live by one, so it's a little more challenging to go there to go vegetable shopping. But what I've noticed that in the last, I'll say again, 20 years, that the amount of produce that they carry in the supermarkets has gotten exceptionally small. And the stuff that they do carry is nasty. I went shopping this weekend and I was looking at like some cauliflower, but it had brown spots on it. Sorry, I won't buy it. Was looking at the broccoli and it was all kind of soft and wilty. Sorry, won't buy it. And they didn't even have green beans. I'm like, what the heck is going on?
Well, I think it's the food industry responding to consumer trends, which is just as you were saying, it's convenience, it's boxed foods. One of the best things you can do is shop the perimeters of grocery stores. That's where the fresh produce is. That's where the fresh protein is. It's not in the center aisles where there's boxed foods or frozen foods. But I think you're right about that. I will tell you, I live in South Florida, so I have a tremendous advantage here. We have a tremendous advantage here in that there's fresh produce available virtually year-round here because of the seasons. And it's one of the reasons that we live here. We go to a local farmers market every other Sunday where we can buy from the growers themselves. It's affordable, the food tastes better, and I just feel better about purchasing it. So you can't do it everywhere in the country, particularly if you're living in a cold climate where you're getting socked with snow. But during the warmer seasons, certainly over the summer, virtually everywhere you can get fresh produce and seek it out. Usually, I always make an effort, too, to talk to my grocer. I will find the person to say, I really like that you have this today. I really like that the organic aisle in my grocery store is bigger than it was, a month ago or 2 months ago. I'm glad you're carrying this product. And I'll make an effort to tell them, because I do think that what the grocers are responding to is what people are buying and what they're interested in. So, just as we talk about being a savvy consumer in terms of your healthcare, you can be a savvy consumer and should be a savvy consumer in terms of your health as well. Wherever you're buying food, wherever you're buying produce, whether it's from the local farmer or from a health food store, from the local grocer, make an effort to tell them what you want. And, you may be that person who stands out in the grocer's mind the next time he's buying or she's buying. I just think that's a way to have a little effect, and it may serve you if you do it.
But then I think, well, yeah, but then you're all healthy, and now you're still paying these really high premiums for health insurance. I mean, my husband gets on my case. He's like, we have insurance. You could go to the doctor. It's like, for what? That's my, it's like, for what? I'm not sick. I'm not dying. So what would I? And so it's kind of like going to a buffet and you're anorexic. You pay all that money to get all you can eat, and you eat like 3 green beans, and that's it. And so, and I think that there are people that are in situations like that where they're really not utilizing the services that they have an opportunity for, but they're paying for them. Where there are other people that, go there every week. I mean, I know some people that are at the doctor, at least monthly.
Yeah. No, you're absolutely right. It's true. And in fact, one of the problems with the existing healthcare system is that it really does cater to that overuse of procedures and tests. And, the people that are there every other week, or with every pain or every little, I didn't get sleep last night, it must be because I have a brain tumor, those folks who are really overutilizing, I think it's a problem. And the truth is that doctors feel an extraordinary amount of pressure to respond to those folks and do something for them, rather than just simply standing up and saying, well, you know what, let's keep an eye on this. And if it continues for a couple of weeks, then we'll come back and we'll send you for testing. But I think many doctors have been too quick to send folks for tests for a variety of reasons, including the fact that patients demand them. But we haven't really talked about it, but one of the other issues that isn't really effectively dealt with in Obamacare is the whole question of medical malpractice and frivolous medical malpractice lawsuits, which is one reason doctors order an extraordinary amount of tests for many patients, because they're using them as a hedge against being sued later by a patient who says you missed something that you should have caught. And medical malpractice insurance for many doctors is an extremely high price, and that's one reason that so many tests are done for patients, and why so much of the healthcare dollars that are spent in this country are wasted. There was a study that came out a couple months ago by the Institute of Medicine that said that the U.S. healthcare system squanders something like $750 billion a year on practices and procedures that don't make anybody healthier. They don't help you live any longer, and they're of questionable value, and some of them may be even harmful. A big part of that cost is for unnecessary services and tests that people just really don't need, but doctors send them patients to get them just so that they're protected from malpractice. So, we talk about the amount of money in the healthcare system. I mean, $750 billion, that's a lot. That's more than the Pentagon budget. That's more than the Medicare cuts that are projected to take place over the next 10 years. And that amount of money could virtually cover every uninsured person in this country. So how we get around that problem, how we deal with that question of overuse of services by the folks who take advantage and the doctors who are willing to let them do so, that's a problem that we haven't really fixed with Obamacare, and probably one of those things that I suspect will come back that Congress and a future president of the White House probably will have to deal with as we reform medicine.
When you look into this, how are doctors receiving all of these changes? Are they good with it? Because there's not just the administrative part on their side. I know that HIPAA didn't go over real big, but there's the administrative part on their side. But is there, as far as how much they can bill, and their whole part in it, does that all change too?
It does, and in fact, doctors have been very vocal critics of Obamacare. Before the law was even passed, several surveys of doctors were conducted and released, that found that huge minorities of doctors were saying, I'm getting out of this business. I'm either going to retire early, or I'm going to pick another profession that's healthcare related but not be a practicing physician, or I'm just going to entirely leave and move into an entirely different industry. The problem is that I can't remember what the numbers are, but it's a fairly high percentage of doctors that are approaching retirement age. I think it's 1 in 4 or 1 in 3 who may retire in the next 5 or 10 years, just as we're going to get a huge influx of new people with insurance who are likely to need and seek care. I think that's a real concern. If you already are at a place in the country where you have a long wait for a doctor appointment, or you go into a waiting room and you're sitting there for an hour and a half because your doctor has overbooked because he or she has too many patients to see in a particular day, that situation is almost certainly going to get worse. The reason is all of the new laws that are required for doctors do place not only a greater amount of effort, they have to take a greater effort to comply with them, but they also, in many cases, are going to have to spend more money to keep their practices going and hire more folks. 2 examples I can give you. Electronic medical records. All doctors in the country need to convert from paper to electronic medical records. That can be a costly thing to do, and you need to hire staff who can look at them and make sure that they're monitoring those records. The other thing that's happening is doctors who treat patients with Medicare have seen a big reduction in the reimbursements that they get from the government for those patients, at the same time that costs for care for those patients, typically seniors, folks needing more care than most people, have gone up. So their costs are going up. The time and demands that are being placed on doctors' offices are going up, and the amount of time that they're able to spend with the patients, which for many doctors is the reason they got into the business in the first place, they want to help people, that's going down. So I think for many doctors, it's going to be a situation where we're going to see folks leaving the profession just at a time that we really need them. And that, from a consumer standpoint, a consumer health standpoint, that's a real big concern. I do hope that medical colleges, medical schools are going to be able to enroll more students and move them in to replace some of those retiring doctors. But at this point, the numbers really don't show that there are going to be enough graduating residents and students from medical schools that will replace the number of doctors that are expected to retire over the next decade. So you're asking a really good question there, and the answer, unfortunately, is not a real happy one for a lot of patients.
I was talking to this young doctor the other day, and he was telling me that he felt so misled coming into the field because he wanted to be a doctor. He wanted to help people, and his feeling is that he's scheduled to work so many clinic hours a week, and so he does that, but it always runs over, and then he has to do the paperwork. So by the time he gets done with everything, he's still working 50, 60 hours a week, but only getting paid for like 20. And and then he doesn't really have the joy of working with people, and it feels so bound by the laws and the fear and the insurance and the this and the that he's thinking about getting out of it. But because he's a young doctor, he has still all of his loans and stuff that he has to pay. So he kind of feels like he's between a rock and a hard place.
Mm-hmm. Well, those loans are enormous. I mean, if you've spent the years in medical school that you need to become a primary physician or a specialist you're paying off those loans for years and years. So it's a big issue. Again, this is one of those things where solutions do exist, but they're really not codified as part of the healthcare reform law. There is a program that does allow for medical students to get either scholarships or have their loans repaid by the federal government if they will agree to practice in those places in the country where they are in greatest demand, that is, where there are the greatest shortages. And there's only enough money in the system to pay for something like, I'm trying to remember the number, under 5% of graduating medical students would actually qualify and be able to get the money to do it. But there's a case where if you're taking money and you're spending a ton of money on healthcare, this is a problem where we really need to be putting funding to try to provide incentives for doctors who want to do the right thing. Think about it. If you're a doctor and if you practice what's now called concierge medicine, you can limit the number of patients you see so you feel like you're giving them quality care. You're making a decent living, whether it's paying off your loans or living a lifestyle that is comfortable. And it just requires those patients to pay out of pocket for, it's usually a couple grand a year for, their doctor's cell phone number and the ability to schedule an appointment within a couple days of calling. That's very appealing as an option to doctors to move in that direction. But from the larger consumer perspective, the only folks they're going to be able to see are those folks who have means and can come up with that money. So folks who are trying to get in and see a doctor and may not have the couple thousand a year to hire a concierge doctor are going to be out of luck. And I think that's one of the major unreported problems and unintended consequences, perhaps, of Obamacare is the rise in the shortage of doctors. And you really can't blame them for looking at other alternatives. So it's going to be one thing that I suspect we're going to hear more about in the years ahead.
Okay. One more question before we go to break. So you're thinking or you're seeing that there is a rise of doctors that are either withdrawing themselves from the whole insurance system in general. I know that I've heard stories of doctors not taking Medicare, because of the lack of reimbursement that they're getting for those patients and the amount of paperwork that they're required to do. So are you thinking, or is there actually a trend of doctors pulling themselves out of that whole insurance loop?
It's already happening. Concierge medicine has been the big story in the practice of medicine in this country for probably 5 or 6 years, as many doctors saw that it was a good option. I can tell you from my personal perspective, I have had, in the last decade, I'm trying to count them up in my head, I've had 5 primary physicians. 2 have left the profession. 1 went into concierge medicine. 1 went into, joined an anti-aging clinic down here that practices alternative medicine because it was more lucrative and she felt that she could do better by her patients. And the 5th I still have. He's still practicing. But there's a case where in just 10 years, my personal experience is that there are been such changes in medicine and in the practice of medicine, physician practices, that 4 of the 5 have left and gone in one direction or another, but have basically removed themselves from traditional insurance-based medicine. And that's before all of the impacts of Obamacare have had an effect. So it's a trend I'm already seeing. I suspect it's going to continue to escalate over the next decade.
Makes you wonder who's going to see the rest of us.
Doesn't it? Indeed. You're right.
But we're going to talk more about that on the other side, where we get into, some of the rumor things that have been flying around. And so the music should be coming up here in a second. So I'm Dr. Rita Louise. We're talking to Nick Tate about his book, ObamaCare Survival Guide. His webpage is www.newsmaxhealth.com. And we will be back with Nick and more about Obamacare after these words from our sponsors.
Just Energy Radio with your host, Dr. Rita Louise, will return right after these messages.
the crossroads in your life and discover alternative solutions to your deepest concerns at soulhealer.com. So whether it's a physical problem, an emotional issue, a question about work, or troubles in your relationships, naturopath and medical intuitive Dr. Rita Louise can help you. Bring peace, harmony, and health back into your life. Schedule a session today. Visit soulhealer.com right away and live the life you've been dreaming of.
Don't have a computer? Is your internet connection down? Don't worry. Use your trusty landline or cell phone and dial our call and listen lines at 832-280-0830 or 786-837-2262 to listen to the Inception Radio Network 24/7. Again, those numbers are 832-280-0830 or 786-837-2262. For the Inception Radio Network, I'm MJ.
Go deep inside yourself and venture into the realm of the unconscious mind with my Meditating on the Kabbalah guided imagery audio CDs. Discover who you are and what you want in life. Meditating on the Kabbalah can help you to open, clear, and revitalize the energetic pathways of your subtle being. They will support you in your spiritual quest by helping you to access the profound insights and inner guidance you need as you work in alignment with your highest good. Let them help you to release negative thoughts and emotions and clear away any limitations that may be keeping you from experiencing your full potential. Walk down the path to health, healing, understanding, and enlightenment with Meditating on the Kabbalah. Order your copy today at www.soulhealer.com. That's right, that's www.soulhealer.com.
Hello, Inception Radio Network listeners. This is Amanda. Remember, you can take your Inception Radio shows on the go. Just download the Inception Radio Network app for your iPhone, iPad, or Android smartphones and access live shows, past shows, guest lineups, and much more. Just visit the iTunes Store or the Google Play Marketplace and download it today for free.
And now back to Just Energy Radio with Dr. Rita Louise.
Hi, and thank you all for staying tuned to Just Energy Radio. I'm your host, Dr. Rita Louise, and we are here talking with Nick Tate about his book, ObamaCare Survival Guide. But don't forget, Just Energy Radio is brought to you by soulhealer.com, and you can listen to the show live every Thursday evening on the Inception Radio Network. But please do go by the Just Energy Radio webpage and sign up for our weekly newsletter, which will keep you informed about the programming that is coming up on the show. So, Nick, we've been talking about the coverage and the doctors, or at least the doctors, and, different parts of this Obamacare bill. You were talking about everyone's going to have insurance. And so there are people that have insurance now. All right, you take a break and your brain just falls out. I think I need some medication. I need to go to the doctor. There's just so much to talk about. So I'm so if somebody doesn't have insurance currently, how do they get insurance? Because you were talking about, poor people being able to qualify for Medicare. But I think there are so many people that kind of sit on the line where, they make more than $20 a month, but if they actually had to pay for their health insurance, because they have a family of four or whatever, that it would leave them with a negative income. And what about those kind of people that just can't lay out $1,200 a month out of pocket?
Well, there are basically four provisions in Obamacare. There are four components of the ways in which people will get insurance. Medicaid, which is the program for health insurance for the poor. If your family, you or your family earn less than, I believe it's 133% of the poverty line, you qualify for Medicaid, which means the federal government provides your health insurance. You still have out-of-pocket expenses, you still have other costs for health care, but that's for the poor. Medicare is for seniors over 65, and it's a comprehensive plan that most people are happy with. It's pretty extensive coverage. There are two other ways that people will get health care. One is through their employers. Under the law, starting in January of next year, if you work for a company that has 50 or more workers, that company must provide your health insurance coverage to you, so they pay your premium. The fourth way is through what are called affordable health care exchanges that are going to be created either by the federal government or by the individual states, and they will go live in January. These programs are intended to allow folks who either don't have insurance through Medicare, Medicaid, or their employer to get it on their own as an individual at what is intended to be a more affordable but high-quality plan. Right now, if you're an individual and you don't have health insurance for one reason or another, maybe you're an independent contractor or a small business owner or freelancer or unemployed, whatever it is, you really have a hard time getting insurance. It's very costly. If you have a pre-existing condition, it's very, very costly if you can get it at all. Under these affordable health care exchanges, all of those individuals in a given state will be pooled together, so they will be able to theoretically be able to negotiate better rates on insurance by pulling together the millions of people in a state that aren't getting their health insurance through their employer, Medicare, or Medicaid. So on paper, those are the four ways in which people will be able to get insurance. And as you know, as of January 1st, you won't have a choice about it. You have to have insurance. Every American in the country has to have insurance or will pay a penalty or a tax. So on paper, these are the four ways that people will get them. There are some questions about how effectively those programs will run, whether they'll actually be up and operating by January 1st, what they will cost, what they will guarantee, and how they'll be paid. But that's the framework for where you will get your insurance. And my prediction is in the next 6 months, you'll hear a lot more about these affordable healthcare exchanges because a lot of people, some 26 million Americans who don't have insurance now, are expected to pick it up through those plans.
Okay, but what if you're one of those people that would like to use the affordable healthcare exchange, but it's still price prohibited, and so you end up paying this penalty tax thing? Does that cover your insurance, or are you still required to get insurance, in addition to paying a penalty because you don't have it?
For every year that you don't have insurance, if you just decide you're not going to have it, you have to pay the IRS, or they will garnish your wages, it seems. We're not really sure how they're going to go after people.
And so you're not really getting any insurance.
Right. You're just paying the penalty.
Ooh, that's even worse than I thought.
The theory there, the working idea there is that you're paying into a system then for the tax system that then allows you to continue to get care at a hospital or some other clinic where you're not paying for your care. So the idea is to offset the costs of those kinds of care arrangements. You would have to pay into the IRS, but paying the penalty doesn't give you insurance. You're just paying a penalty, essentially what happens. So the question is, how many people are going to do that? The other question is how is the IRS going to enforce it? At this point, the IRS has said that the agency needs to hire about 16,000 new employees just to police this part of the law. Is Congress going to give them that money to do that this year? It remains to be seen. Congress hadn't been too free with the purse strings for a long time. So how they actually enforce that law is unclear. And how many people are actually going to say, well, I'm not going to pay for the insurance. I'm just going to wait for the IRS to come get me. We're not sure how many people that's going to be either. So that's one of the details of this law that has yet to be kind of worked out and remains to be seen.
I mean, it is just mind-boggling to me. I mean, I know a lot of people that barely make over minimum wage, or maybe make $12 an hour. And these are people that had some of my friends had, big corporate jobs, and due to layoffs, they're working at Home Depot because it's money. It's just mind-boggling.
Well, that's there's no question about it. For the number of people who are out of work, or have not had a raise in however many years, or have had to take hour cuts or pay cuts, there's a lot of folks out there for whom financially it's a very difficult time. If you look at young people, there is one benefit in the law to people under the age of 26 and under. If you're 26 or under, or have a child who's 26 or under, if you're a parent of a child who's 26 or under Obamacare right now, you can stay, parents can keep their kids up to age 26 on their health care plan. So if you're a young person who's just graduating from college or high school and having a hard time finding a job, which is an enormous number of young adults, you can stay on your parents' insurance plan up to age 26. But beyond that, up above age 26, there really isn't that kind of protection. So I suspect there are going to be a lot of people in that situation who are going to say, well, you know what? I haven't had it yet. I haven't had insurance yet. I'm going to go bare. I'm going to wait and see what the IRS does and if they actually come after me. And based on what they do, they may decide to have insurance or not. It just remains to be seen. We don't know.
Well, yeah, but we know how the IRS operates. They wait 4 years and then they say, well, you only owed us $20, but with taxes and interest and penalties, it's escalated to $20,000. That's due tomorrow. That's been my experience.
No, you're right about that. And the penalties could accrue. But the question is, are they going to have enough people to really police it? I was talking to somebody at a conference that I went to a couple of weeks ago, an insurance underwriter, and the suggestion was made that the expectation, perhaps, by the authors of Obamacare is that people would just simply follow the law, and that for the vast majority of Americans, they'll do what they know they're supposed to do, whether they're a business that has to provide their insurance for their employees, or whether they're an individual who has to buy insurance because the law provides it. And, I do wonder, it made me think, is there a thought that even if they don't go after the scofflaws and the folks who don't follow the law, are the authors of Obamacare and the proponents banking on the hope and the belief that, in fact, most people will do what the law requires? And will that be enough to make some positive changes in the healthcare system? But it's one of those things where we'll have to kind of wait and see what happens. For people like me who cover healthcare, it's going to pretty much guarantee that there's going to be a lot to write about in the next year or two or more.
Job security for you, huh?
Oh, yeah, I hate to say that, but, it really is. In some ways, it really is true.
But what impact is this law going to have on companies? You mentioned that companies that have 50 or more employees have to have insurance. 50 is really not a lot of people. I worked at one company and it was considered a small business because it had under 500 employees. And it was an okay sized company, but it wasn't huge. And I can't even imagine, just having 50 people and being under that requirement. It just seems like a lot of small businesses will end up going under because they can't comply with the law.
Well, I think a lot of the businesses are going to just what the law says is if you have 25 or fewer employees, if you're a small business with 25 or fewer, you qualify for a tax credit that ranges between 35 and 50% of what you pay for insurance for your employees, a tax break moving forward. If you have 50, but you don't have to provide your insurance, it's just a tax break for those who do. You don't have to cover your employees. If you have between 26 and 50 employees, you don't have to do anything, but you get no tax break. But if you employ 50 or more, you have to provide health insurance to every worker, or you pay a penalty to the government that eventually gets up to about $2,000 per year per employee. That's a substantial chunk of operating change. Healthcare costs range between $400 and $4,500 per employee and something like $16,000 per family. That's a lot of money for insurance companies or for companies to pay for insurance premium for their employees. So the suspicion is, the belief is that many companies are simply going to agree to pay the fine because it's substantially less than the cost of covering their workers. But even still, that's a fair amount of money. If you employ 60 people and you have to pay $2,000 per person, there's a discount. I think the first 30 employees are exempted, so it's not exactly 60 times 2,000. But that's a lot more money to operate that business. And the question is, how many folks are going to drop their employees' insurance? How many employers are going to be cutting workers' hours because it's full-time workers that have to be covered? And how many people are going to find themselves looking individually for insurance, or maybe some additional hours like a second job because both their insurance and their hours have been cut? That's a question that seems to me we're not going to really see answered until this law takes effect January 1st. I will tell you, though, that one of the individuals that I've spoken to at this insurance conference that I went to said, if you were looking to design a better job-killing bill to try to halt the recovery that we're starting to see in this country, you couldn't have come up with a better way to make many small businesses say, I just cannot hire new people, and I'm worried about being able to keep the people that I now have. And these are companies small businesses that want to do the right thing by their folks. So it's putting an enormous stress, it seems to me, on those smaller businesses that are at that 50-employee mark. And it just remains to be seen the impact it's going to have.
But I think it's having impact even in bigger businesses. And I can't remember who it was, but my husband was talking to someone at Chili's or IHOP, some food place, and they were already saying that their hours had gotten cut from, like 38 to 40 hours a week to 20 to 24 because it kept them in the part-time category, and that the company was bringing in all of these other workers to fill slots, but they weren't going to have anybody that was considered a full-time employee because then they didn't have to provide any kind of insurance anymore.
I believe it's Darden Restaurants, has the folks that run Red Lobster and Olive Garden have made clear that they're already experimenting with those kinds of arrangements with their employees and cutting their hours. Look, the big companies that need to offer health insurance to either recruit or retain top talent, they're obviously going to continue to offer health insurance benefits as a compensation package. And the estimates from the Congressional Budget Office are that most of those big companies will continue to provide health insurance. And right now it's about 150 million Americans that now get their insurance through their employment, just FYI. But for those big operations that really don't need to offer health insurance, and I'm thinking, fast food restaurants, restaurant chains, major retailers, they really don't need to offer those kinds of benefits to either recruit or retain their employees. And for many of them, that unskilled labor or minorly skilled labor force, there's a constant supply of those folks. So if it costs you less money to hire two people to get the same amount of work done and you don't need to pay their health insurance, well, what's the better financial decision for a business? I think it's obvious. And so folks who are employed by those companies, I think, are going to get hit, and those companies themselves are going to have to take a hit. There's a question about whether or not. What I've heard said is that many companies are just going to simply say, you know what? The government's creating these healthcare exchanges. They're expanding Medicaid. We're just going to get out of the health insurance business. We're going to hand it off to the government, and we'll send the folks to these affordable care exchanges where they can get high quality insurance at an affordable price. Why do we even need to stay in the business of health insurance? And I understand that perspective, but it changes very dramatically the way in which health insurance and health coverage has been provided historically in this country since the First and Second World War, which is it's an anomaly. Many countries don't have the kind of economic-based insurance program that is employer-based and worker-based and business-based that we have in this country. And by and large, there are problems with the healthcare system, but if you ask the average employee, they're happy to have their benefits from their company. And the big experiment that we're going to see in the next 10 years is to what degree is Obamacare going to basically fundamentally change the nature and the balance of that. And, the smart money is that a great number of companies are just going to simply get out of the health insurance business and leave it to the insurance, healthcare exchanges and the other government programs. So I think we're going to see some big changes for millions of people in this country in the next year or two.
But it doesn't sound like, unless you cut your workforce to part-time, that you can really get out of it because you're required to carry it.
Exactly right.
Or provide it.
there are some questions about. We're going to get in the weeds a little bit here, I fear, but the law specifically says, the technical language in the law says, businesses must provide coverage for their workers if it's 50 or more, or send them to the health care exchanges that are being created in the states. But in those states that have said they're not going to create these health care exchanges, which is about half of the states, they're going to either give them to the federal government to run, or they're going to work them in partnership with the federal government. Some legal scholars have said the law may itself not provide the ability for the federal government to enforce that provision. So there are some questions about whether they're going to actually be able to go after those businesses in those states where there are no affordable health care exchanges and enforce this part of the law. And one of the states has already filed suit to kind of force a ruling on this. So I think it's one of those situations where there are lots of questions about how it will be enforced, but I kind of agree with you. I don't think there's going to be a way for businesses to really get out of this. You're probably going to see more part-time work. You're probably going to see more contractor work, which has kind of been a trend in certain industries anyway, as opposed to having 50 full-time employees. Companies may have 40 full-time employees, and they may have 10 contractors who work as many or close to as many hours. And it remains to be seen about whether the IRS is going to allow that, or whether there will be some crackdown on that too. But it's not the changes in healthcare. I think are going to have a larger impact on the workforce in this country as well, for just this reason.
I mean, it's just kind of a joke. It just makes me feel like there's going to be more finagling and lying and cheating going on in big business just to get around this mandate than truth.
Well, it's hard to say. My hope is that scrupulous businesses will still do right by their employees, and certainly follow the law, most of them. But it does raise questions about whether there will be kind of abuses and loopholes that companies will use to get around this aspect of the law, either by contracting work or hour cuts or other means that we don't even really know about. But that's right now. When I hear from people who are small business owners or large business owners, that's the question I hear most. It's not about the individual mandate, about what's required for people to get insurance. It's really about how are businesses supposed to respond? What do we have to file? Who do we have to tell about what we're doing for our employees? And it's enormously complex. There's a part of me that believes that the deadlines are coming up so quickly, January 1st, on these provisions, the individual mandate, expanding Medicare, creation of the Affordable Care Exchanges, the mandate on businesses. I almost don't see how they can possibly get their ducks in a row, the regulators, to make all of this happen by the schedule and by the deadlines, particularly when we can't even get Congress to pass a budget these days. How are they going to agree on how to implement the aspects of this law that are supposed to kick in just 9 months from now? It remains to be seen.
Well, I'm glad we have someone like you keeping her eye out and watching stuff like this. There's the book, but do you constantly put out, because you're a journalist and a news guy, do you constantly put out little updates? Do you have a blog that you kind of keep people up to date on what's going on this bill or in healthcare in general? So, outside of this, where people want to just kind of keep in touch with you and keep informed of, some of these new things that you're finding. Is there, a webpage or anything like that?
Well, there is. I don't have a daily blog. I'm a reporter and an editor, so I'm writing and editing stories every day on health and healthcare for Newsmax. The Newsmax.com website does have a daily, almost every day, there's something on healthcare and healthcare reform. And I write, depending on the day, between 4 and 8 stories a day on medical health updates. Many of them are based on new research and new studies that tell people, best practices for diabetes, heart disease, cancer care, as well as wellness. And you can find that at Newsmax.com at the health site, newsmax.com/health. There is also a website that we've created, ObamaCare911.com, that gives people information about the book. And from that site, you can get to a reader Q&A. So if you have a question and you want to know, I'm a senior on Medicare and I want to know whether I should be buying Medigap coverage, or I have Medicare Advantage and I'm paying more money, why is this part of Obamacare? We do have an in-house person who I help answer those questions for. So we're trying to really be as useful a resource as we can be to folks who are looking for that kind of consumer information. So it's not a blog, but it's what I think is the next best thing, which is a news-driven approach. When there's news, we write about it, we post it on the site. You can find it at newsmax.com/health.
But that's good. And if they want information about the book, I'm just going to say this one more time, ObamaCare911.com. Check it out. Okay, back to the questions. So let's just talk about, I want to kind of transition into the more conspiratorial rumor stuff, but there was a couple of things that I think a lot of people have concerns with in the general sense on a personal level. What about things like long-term health care and prescription drug coverage? Because those are huge.
There's really virtually nothing in the law that deals with the problem of long-term health care. There was a program called the CLASS program. There was a provision in Obamacare that was very specifically designed for people who would need assisted living or nursing home care. But they ended up Xing it, getting rid of it, because I think there was a perception that it would be too politically hot because it's a costly program. And so right now, all of the rules still apply for nursing home care and Medicaid coverage of nursing home care, which basically means you need to be destitute to qualify for Medicaid. One of the big messages that I'm trying to get out in the book and in my conversations with folks is you really need to be doing something to save for the future, whether it's a health savings account, which allows you to set aside tax-free money to use to pay out-of-pocket expenses, or saving for your future for those kinds of provisions. You know, people are living longer than ever before in this country, and something like 1 in 4 Medicare recipients, seniors on Medicare, exhaust their life savings in the last 5 years of life through out-of-pocket end-of-life healthcare costs. So there really isn't a solution to that. It's an enormous problem, and I think it's, again, one of those things that's going to come back that Congress will have to deal with in some fashion to deal with all the folks who are going to need long-term health care. Prescription drug coverage is a part of the health care plans that will be what are called essential health benefits for all policies that will be offered through these health care exchanges next year. So the intent, and we'll see what the government comes up with, is that there will be very specific details on what a Blue Cross Blue Shield health plan will offer in terms of drug coverage versus a Humana plan versus a United Healthcare plan. The law requires that every insurance company that goes through these exchanges that the states are running or the federal government is running detail, as now happens with employer-based insurance, just exactly what they will and won't cover for drug benefits. The federal government has yet to really set what those essential health benefits will be for drug coverage, but they will be spelled out, at least the law requires that they will be spelled out in these healthcare exchanges. So the prescription drug coverage piece of it, I think, will be clearer, and you will have the ability to choose in a way that gives you an apples and apples comparison of various plans that are offered. But we really have not yet dealt with the whole question of long-term health care for people who will need assisted living or nursing home care. And what's the number? Something like 10,000 Americans a day turn 65 in this country with the aging of the boomers. So it's obviously going to be a bigger issue that they haven't yet dealt with, as will what to do about Medicare, which is also a problem.
Yeah. Speaking about Medicare and the elderly, so one of the rumors that flies around is this whole talk, and I'm going to use this phrase, and you can kind of change it to whatever word you want, but about these death panels, and that there's going to be this group of people, qualified or not, we don't really know, that are going to make decisions about whether a a plan will cover a certain procedure or not, and make decisions whether they're going to provide services. Is there any talk about that? Is there any reality to that?
There is a kernel of truth to that. Now, I have to just say that Sarah Palin's claim that Obamacare would create death panels that would basically decide who lives and who dies in a hospital has been largely debunked. There are not going to be hospital death panels. There will not even be a federal bureau of experts that will say this person will get care and that person won't get care. However, the kernel of truth that led to the claim about death panels, and I'm not trying to pick on Sarah Palin, she just became the most visible person articulating this point of view. The truth behind that claim is that Obamacare does create what's called the Independent Payment Advisory Board. And what this is, it'll be created, the president will pick 15 healthcare experts and the Senate will approve them. And this board will be charged with making recommendations specifically on Medicare cuts, spending cuts, if they're needed beyond the $716 billion that Obamacare will cut from Medicare spending over the next 10 years. In other words, if Congress doesn't go far enough, and the White House won't cut Medicare to make sure that it remains solvent, then this board is going to be charged with stepping forward and saying, we're going to recommend these various cuts to Medicare to make sure that the books are balanced. The problem that critics have identified is that this board will operate almost like the Federal Reserve, only for healthcare and for Medicare. And as a result, this board's decisions will be binding unless Congress, by a supermajority, a 3/5 vote, overrules them. Now, Congress hadn't had a supermajority vote on anything that I can remember in the recent past. So the expectation is that this group, this Independent Payment Advisory Board, will be able to wield enormous power. I will tell you two other things about this, and I hope we're not getting in the weeds here, but this group is not, they're explicitly forbidden from setting policy and saying, here's what Medicare recipients' benefits will and won't be. So they're expressly forbidden from identifying benefits that can be cut or programs that can be cut. They're just about the money. However, if you cut money that funds programs, it's going to have an effect down the road. So if hospitals, doctors, and other healthcare providers are given less money to administer care to Medicare recipients, the concern is that they just won't be able to do it for everybody who needs it. So in places where there are a lot of older folks, retirement communities, places like South Florida, frankly, there may be, this is another one of those hot button words, but there may be some rationing of care. Meaning if you can't provide it to everybody who needs it, you'll have to provide it only to those people who need it most. And that's really where the whole death panels idea comes in. The concern,
But that doesn't sound really fair because people like myself and yourself have been paying into Medicare since the first job we had. And now it's like, oh, wait a minute, I want to use it and bye-bye, it's gone.
You're absolutely right. And as somebody who is looking to turn, to have Medicare in about 10 years, when I turn 65 myself, I don't think it's going to be there. Not in any fashion, in any form that we now recognize. Now, this is one of the, again, when I say Congress has not really dealt with this issue, Medicare, the whole question of Medicare, Social Security, and other so-called entitlement programs, they really have not figured out what to do about. The problem is that there are far too many people who now receive Medicare benefits, and there aren't enough people who are working, paying into it to cover all those folks, and that imbalance is only going to increase. My opinion, by 10 years from now, they will have to change Medicare in some fashion. It'll either be a base level program that only provides the bare minimum, and then folks will get Medigap coverage, insurance above and beyond what the federal government will pay for to cover their differences, which you now can actually do, and many smart people do, to pick up those costs that Medicare doesn't cover. or they're going to have to go to a program that looks like what Mitt Romney and Paul Ryan have been advocating or were advocating last year, which is more of a privatized program where the government would give you what they called premium supports, and the Democrats criticized as vouchers, where you would get a certain amount of money every year, the equivalent of, I think it was $80,000, for your individual premium, and then you would buy your own health insurance. And for somebody like me, who I like to think is a savvy healthcare consumer, I'd be happy with that. Tell me how to manage my own money. If I had to choose between what the government tells me I have to take, or they're going to give me the money to buy my own plan and make my own choices about what's best for me, well, I like that idea because I feel like I'm a savvy consumer and I'll be able to make a good choice for myself, for my family. I think the concern is that for a lot of seniors, they don't have any idea how to begin to make a choice like that. It's so complicated. If you're choosing between dozens or hundreds of plans, how do you know if you're making the best decision? So how that gets sorted out over the next decade is really, I think, going to be key for a growing number of graying senior Americans. If I had to predict whichever way we go with this, I think seniors in 10 years, and probably between now and 10 years, are probably going to be shouldering a lot more costs for healthcare than they have had to in the past. I just think that's going to be as Bill Clinton liked to say, that's just math. I think that's really just the truth. What it's going to look like, though, in 10 years, we don't know.
Well, I'm sorry. I just have an issue with there are so many other people on other kind of entitlement programs that are not old. That it just doesn't seem fair to people that have, done their thing for them to be screwed. Sorry. Just a little political commentary there.
How can I not agree with you? I'm somebody who is going to be looking at the potential of having. I took my first job when I was age 16. It was a summer job, and I've worked since then. I worked through college, put myself through school. I'm one of these folks who's always. I like to work. I like my work. I like what I do. But I'm looking at the possibility of having put 50 years of paid into the system for 50 years, and then when my time comes and I need it, I don't know what's going to be there for me. And I'm worried about that. I'm absolutely worried about it. I will tell you, though, that I think that it makes sense, and this is part of the other message of the book, is don't wait till you're 65 to figure out what your plan is. If you can be investing now, if you can be saving in a health savings account, maximizing your tax benefits by putting money away, that money, a health savings account, is tax-free, and you can roll it over year to year. So you can build, over the next 10 years, I can build that plan so that when I'm 65, if Medicare doesn't have everything that I need, I'll have, a little nest egg that I've built up to save. I think people really need to be thinking about it in terms of the future. I wish when I was 22, I had created a health savings account and was adding to it every year. Where would I be now had I done that? And I'm trying to counsel my own kids who are in that age group to be thinking about that. But, you're right. It feels like it's not an entitlement that is a gift. It's not a handout. It's something I paid into. It's an investment that I feel like should pay off for me after 50 years. But the math, the numbers just tell me that it's not going to, and I'm worried about that.
Mm-hmm. Then you hear these rumors about bad patient experience, where you need to go see the doctor, or you go to see the doctor and you have to sit in long lines. You can't really be seen. I have a girlfriend who's from Canada. And this is an amazing story. So her sister is a parachutist, and she jumped out of her plane, and the parachute did not disengage or engage fully, and she crashed into the earth from an airplane. And remarkably, she actually got up and walked, but they took her to the emergency room, and apparently she had broken her back. But she was ambulatory. She could get up and walk, so she wasn't, like paralyzed or anything. And they sent her home, and they said, come back in 6 months and we'll do an evaluation, because that was the first appointment they could get for her. Do you think we're going to have the same kind of experience here?
Oh God, I hope not. I mean, that's one of the raps against the Canadian system and the universal healthcare systems, is that there often are very, very long waits. And the system, for all of its flaws, the U.S. healthcare system arguably is one of the best in the world. If you have access, if you can pay for it, we have the best doctors. We have incredible medical technology. The advances that are made here, and we're one of the leaders in the world when it comes to medical technology and advances. It's an enviable system. I'm hoping that the changes that come with Obamacare don't push us in that direction. But as we've kind of been saying here, there are so many uncertainties. There are so many unintended effects. We really just don't know. We do know that there are going to be probably doctor shortages. We do know that the amount of money that's going to be spent on healthcare from an individual consumer and a business perspective is going up, but at the same time, the amount of money flowing to doctors' offices and hospitals is going down. So those pressures may in fact lead to the kind of, nightmare scenario that you've just described. What an extraordinary case, though. She fell from a plane and was able to live. That's kind of miraculous all by itself. Amazing.
Well, I guess, the parachute worked for a while, but then somebody came by her or something and the strings got tangled up, so she was partially engaged. I don't really know the entire story, but I know airplane, parachute, crash on the ground.
And then the nightmare at healthcare, and then the nightmare healthcare interaction began after that. It was
Right.
Well, the other thing that is we're already starting to see happen. There are a lot of doctors and there are a lot of people who are patients who are going to other countries for care because it's more affordable. Costa Rica has an enormous medical tourism program, for instance, and people go and get pretty good care there, and they pay less for it. Will that happen more? Possibly. I've heard of doctors who are looking to set up shops in the Caribbean, the Bahamas, and Latin America, where they don't have to live by the provisions of Obamacare, and they may have a greater degree of freedom to treat patients as part of a travel trip. Now, I should point out that Costa Rica has universal health care also. So, there are probably some provisions that doctors have to provide, regulations they have to abide by as part of that plan. But there could be changes, involving other countries or neighboring countries, or this kind of medical tourism trend that we've seen for the last couple of years that may take off in the next decade. It remains to be seen.
So now we're going to outsource healthcare. Just a commentary. I'm moving along. One of the most controversial rumors that I've heard was this concept of the RFID chips, the little, ID chips that they stick underneath your skin, that those were going to be required because they'd put your electronic health record on it. And if you didn't have an ID chip, you wouldn't get seen by doctors.
These have been enormously controversial for obvious reasons. The technology does exist, and there are some applications that I will just tell you, my opinion is that could be useful. If you're unconscious and an arriving EMT ambulance specialist doesn't know what you're allergic to, what your situation is, it could be useful to have access to that information right away. And I do think that there are some applications that make some sense. But the idea that your entire medical health history could be placed on a chip implanted under your skin just sounds sort of Orwellian to me and makes me very, very nervous. We already know that medical privacy breaches happen all the time, where patient records are sent out. I myself, I'm a health writer. Somebody faxed to me personally another patient's entire medical records. It was a woman. And, I ended up calling the doctor and saying, do you realize what you've done here? So having that information on a chip, I think, would be enormously dangerous. I don't believe that under Obamacare, this is a direction that is required. There may be some pilot programs that will see if these make sense from either a financial or a health perspective, but I'll have to just candidly acknowledge that I don't know that they are required. But, as soon as we finish this interview, I may check into that and see what the truth is about them, because there are some concerns I would have about medical identity theft, obviously, as a result of the misuse of that kind of information.
I mean, personally, it's like, well, if you want to know I'm sick, okay, who cares? I would get more concerned with that of what else would they want to put on the chip. I mean, they could start with healthcare, and then what else? You're going to put my, driving record on there. And, if I get stopped, I put my arm out the window and you scan me to see if I've been arrested, or I don't know. It just seems like it opens the door to so much more.
You're right. The thing with technology is there's a kind of gee whiz, wow, look at the potential benefits, but because you can do it, should you do it? Because we have the technology to do this, should we do it? That's really the question that's unresolved. And, let's hope that that's a conversation that continues and a dialogue that continues, and it's not something that's kind of rammed down our throat without much public access or public airing of the potential downsides, because you're right.
So what else have you heard? What are little juicy nugget tidbit things that we haven't covered here do you think it's important for the listeners to know about before we have to wrap up today?
Well, what I would say is this, that there are some 500 provisions in this law, 2,700 pages and new pages being written every day. I believe that this law will touch virtually every person. And depending on who you are and how you interact with the healthcare system, it will depend on what those impacts will be. Seniors on Medicare are going to have different issues and experiences than people with pre-existing conditions. We'll have different experiences and needs than people who are independent contractors, small business owners, college students, people of certain incomes, high and low. So the real message that I'd like to get across is the book is really an overview. It's as specific as I can make it in a couple hundred pages. But there's so much more out there that you need to get informed about as an individual consumer that I think we've moved beyond the place in this country where you can simply go to your doctor once a year and your doctor will tell you what you should do for your health. We have to go beyond that. And if nothing else, the positive trend that I hope comes from Obamacare is people will be driven to take the initiative to take control of their own health and their own health care and evaluate what they're spending. What are they getting for what they're spending? What can they do to improve their health so they don't have to spend as much in a doctor's office or in a hospital or a healthcare facility? That's really the message, is you need to figure out where you are, how you use the healthcare system, how this law is likely to change and affect you, and what you can do about it to maximize both your healthcare dollar and do what you have to do to improve both the quality and, I would hope, the quantity of your life by making smart choices. And I think the book is really just a starting place and a place to begin that process. And I really hope that everyone who hears me and everyone who takes a look at the book or follows this topic will really take the initiative to be a savvy consumer. That's really what you have to do it. It's not a choice anymore. You really have to do it.
Right. And that was why I was like, no, I have to have this guy on the show, because nobody's talking about it. I mean, other than, like Rush Limbaugh and, those people go, making political commentary, but no one's really talking about what the law says and what impact it's going to have on us, and I'll use your word, as the consumer.
Mm-hmm. As a career consumer health writer, I obviously believe that a savvy consumer, an informed consumer, is going to be the person who makes the best choices. And, maybe there was a time when we could simply rely on the experts to tell us we can't anymore. We have to really go out on our own and find out what the truth is and evaluate what's best for us. What's best for me may not be the same as what's best for you. What's best for my family and my kids may not be the same as my neighbor. My health plan that I need for us may be different from my coworker. So you really have to do the homework. You really have to do your homework and determine what the best choices are for you. That's really the best that I can say. And I hope that the book helps point people in the right direction to move them forward. If I can have that kind of an effect, then I've done my job.
Do you know if there are any plans to get people educated to these new laws? For example, I don't have health insurance. I'm one of those people in the gray area. I'm not poverty ridden, but I just don't have health insurance because I don't really make enough money to lay out the expenditure. Am I going to find out in 2014 when I go to pay my taxes that, I screwed up? Or is there going to be some kind of education for people, is the government going to put out the education, or is it really being thrown on us that we need to figure it out? We need to understand what the law says, just because they made the law.
From my perspective, I wouldn't count on the government telling you what you need to know. They can be a starting point, and in fact, if you go to the Department of Health and Human Services website, it's hhs.gov, you can read all 2,700 pages of the law if you want to, or you can go to an organization like the Kaiser Family Foundation, which is very, very useful. It's kff.org. They do a really good job of giving you the things that you need to know and kind of tailoring your choices to your life and your lifestyle. There's really nothing out there that there's general information that HHS and some advocacy organizations are putting out, but it's really the kind of thing where you need to take the initiative yourself as an individual consumer to kind of find out. The good news is there's a range of useful resources online. The beauty of the World Wide Web is that you can really drill down and find out what's best for you. If you have a pre-existing condition, there are advocacy organizations that you should reach out to: the American Cancer Society, the American Heart Association, the American Diabetes Foundation. You should talk to your own doctor. And I do believe there's going to be a growth in the need and the benefits of working with a health insurance agent. There are individuals in every state who are licensed health insurance agents, just like real estate agents or life insurance agents, who can really tell you, well, for somebody in your situation, these are the various plans that the various insurers offer, and this is what you need to consider. I can tell you that when I was working as an independent contractor, I relied on a couple of them myself to help guide me to what was best for me and for my family. So the big picture, I'm sorry, long answer to a very short and simple question, I fear, is that I wouldn't rely on the government to give you what you need to know about the best choices to make for yourself. Consult those advocacy groups, do your research online, talk to other people who may be in a similar situation as you about the kinds of decisions that they've made, but make the effort to kind of do your own homework. There are resources out there. I just wouldn't rely entirely on the federal government, which is going to have a point of view on what you should be doing.
Well, and I just think of the 26-year-old or 27-year-old who think I wasn't thinking about health insurance. Thankfully at that time I was working for companies that did have health insurance, but even when I was a contractor and didn't have insurance covered by my company, I just didn't have insurance. There wasn't anything to think about. Now, as you're saying, if you don't have insurance, then you get hit with the penalty, but that means you have to think about it. And what 26-year-old do you know that thinks about health insurance? None of them.
No, you're right. I think particularly the young and particularly the older Americans are going to be those folks who are going to have the hardest time. And, as we know, there's 37 million legal residents in this country who now don't have insurance. It's going to be very complicated for a number of them to go through this process of picking a plan. I mean, even for somebody who's working with a large employer who provides insurance, you have to take the time to look through what the plans offer, what they will cost you, and what they provide. For somebody who's foreign to that experience, it's going to be an enormous challenge. And, my hope is that the insurance agents and the Kaiser Family Foundations and groups like, Consumer Reports is a good example, that they're trying to do as much as they can to get the word out to folks to make smart decisions. My hope is that there will be a role for them to play, but the truth is individual consumers are going to probably have to seek those folks out and find out from them what they need to know that's very sort of tailored to their specific needs in their specific health situation.
See, I think it's going to be interesting, and because, as I said earlier in the interview, my husband's health insurance is expensive, and it sucks. I mean, it's just really bad. And if we could find something better for cheaper, better.
To return to one of the points that we were discussing fairly early on, could be the best thing you can do for yourself is to live the healthiest lifestyle possible. Maybe now better than ever. You can avoid some of the complexities of interactions with healthcare, like the poor parachuter who was told to wait 6 months to fix her broken back. You can avoid some of those. Well, don't jump out of airplanes, but maybe that's an obvious recommendation. But you can take steps to make sure that you're living as healthy as possible. Keep your diet healthy. Keep your weight at a manageable level. Don't overdo anything, everything in moderation. And keep current with what the guidelines are on health and cancer screenings and keeping heart healthy and, staving off diabetes. It may be more important now than ever to consider doing all those other things you can do to stay out of a hospital and out of a clinic and out of a doctor's office and not have to work through the 27 pages of the insurance filing that you might have to make if you do get sick.
Well, and that's today. I mean, we don't even know how it's going to be. You hear these horror stories of people that, have insurance and they have something done and they're led to believe it's covered by their insurance and then it's not, and they end up with these $100,000 bills. I mean, which is one of the reasons why I try taking care of myself, because, oh man, that whole thing just makes me crazy. And I just can't even imagine it getting crazier than it already is.
Yeah, it's a good reason to take to heart and take the initiative as you're doing that to live a healthy life,
So is there going to be some kind of follow-up to this book? Because obviously as we get closer to the new year, there's going to be new information out, or even when we actually roll in Obamacare, I'm sure there's going to be a lot of last minute shuffling happening. And so is there any kind of plan to do a follow-on book or an update of the book or anything like that?
There is. In fact, the beauty of the technology of modern publishing allows us to constantly update the book. We didn't produce the book as a stone tablet that came out in October and will be the same if you bought it now or bought it in October. With every significant update in the law, we're updating the book. It's a book that allows us to kind of publish on order. So if you're ordering this book from Barnes & Noble or Amazon or one of the major sellers, what you're getting is a book that has really just been printed. So we're able to stay within, it's not up to the minute or up to the day, but we're able to keep the book fairly current, and there have been several updates since the original publication in October. My guess is at least through the next year, the book that people will be able to get will reflect the latest financial projections, the latest requirements on business, the latest mandates that are going to be required on individuals and people who purchase health insurance. And the beauty of modern day publishing is you have the technological ability to make the book kind of a dynamic resource that is updated, and that's what we're trying to do. The other thing is that it's also available as an ebook, which you can literally update, moment to moment. And so I'm trying to keep track of all the things that are happening and make sure that if you order the book today, it's got the latest information on the potential impacts on businesses and the requirements. And if you order it a month from now, it will reflect the news that's come out and the laws that have been published in the Federal Register on how they will be implemented. So we don't have there won't be the Obamacare Survival Guide Part 2, but the Obamacare Survival Guide book that continues to come out will reflect the latest changes as we're able to update them, and that's by design. With any kind of law that Congress passes, nothing is ever implemented exactly in the way that it's written. There are always changes between the time of the law's passage and signage and the implementation. So we knew that going in, and kind of the bargain that we made is that part of my job would be to babysit the law and make sure that the latest editions have the latest news in it.
So it might even be a worthwhile thing to get a copy now because you want to see what's going on, and then get another copy or get the ebook or whatever as we get really close to the new year to see any kind of changes that have happened, kind of thing.
You could, or the book, if you buy the book now, it gives you kind of the baseline of where we are in March 2013. And continuing to stay updated by going to, Newsmax.com isn't the only website out there that's giving a lot of attention to this issue. But you can also stay current once you have the kind of baseline foundation for what's in the law, for reading online and staying current with Kaiser Family Foundation or HHS or Consumer Reports on how the implementation of these various laws that have been codified in the law and are in the existing version of the book are going to actually roll out and be implemented. And
if somebody wants to get a copy of the book, where can they go?
Well, it's available at all major publishers, Barnes & Noble, Amazon.com, of course, and a variety of other specialty retailers. You can also order it directly from the Newsmax.com website, ObamaCare911.com. I think we might even give you a discount if you do that. I thanks for that plug. But it's available at all major bookstores.
All right. Well, Nick, I know the music's going to be coming up here any second. Thank you so much for coming on to the show and sharing all of this information about Obamacare. It just seems a lot bigger than I think most people realize it is, and they need to do some homework.
I think you're right about that, and thank you. I appreciate your interest in this, and thanks for having me. It's been a pleasure.
Oh, thank you. And that's Nick Tate, and his book is Obamacare Survival Guide. You can go to ObamaCare911.com and get a copy, or check out his webpage, which is www.newsmaxhealth.com. And then next week, we're going to be speaking with Dawson Church about EFT, epigenetics, and weight loss. Don't ask me, I'm just reporting it. And then Charlotte Zivak about talking with animals. And so until next week, I'm Dr. Rita Louise. This is Just Energy Radio. Be blessed.
Join host Dr. Rita Louise each week at this time for Just Energy Radio. Point your browser to www.justenergyradio.com for more show information and to contact